So even though I work in pain management and most of my patients come to me because they are suffering from pain, most actually report that the reason that they accessed their GP was because of the secondary impact that the pain is now starting to have on their life. I've done a previous video on the boom-bust cycle and ways to overcome that cycle, so check that video out if you haven't already seen this. But today what I'm going to talk about is the opposite of that, the pain cycle and the impact of avoidance over time. So with the pain cycle, what we have is when you are experiencing pain, quite naturally, there is a concern or a worry that that pain is going to get worse. Now, over time, when we have that fear or that worry, it may mean that we start avoiding certain activities that are painful. And again, that's very, very normal. Pain's not a nice thing to be experiencing. And what we tend to do is we tend to avoid those activities that are painful for us. Now, in the long term, what that leads to is it leads to a reduction in strength and a reduction in function related to that activity that has been avoided. When we are having to avoid these activities because of pain, that also can have an impact on the way that we're feeling about ourselves, our mood in the long term. Because if we're not able to do the things that we enjoy, that can really, really have an impact on our mental health as well. Now, all of these things, so reduction in function and an increase in low mood, can lead to more pain. So don't forget, guys, that pain is our protective system and it responds to anything the body sees as threatening. Now, low mood is one of those things that the body sees as a threat, as well as reduced strength, reduced function, and so on. A really important thing to note here is that the longer that we avoid a certain activity, the harder it will be when we return to that activity and the more painful it's likely to be when we return. So for this reason, this pain cycle here can lead to worsening levels of pain. Now, it's not always easy as to say, okay, well, I'll just stop avoiding things and I'll return to normal activities, because pain is still very much a feature here. We can't always control the pain, not straight away anyway. And we can't always help with the fear that that pain is going to get worse or the worry or the anxiety around the pain, because at the end of the day, we're humans and those emotions and those thoughts are very, very normal. But where we can come in is how can we have a look at the activities that you are avoiding and how can we gradually being the key word, return to those avoided activities. What we should find over time then is that the function related to that activity improves, our general fitness improves, our sensitivity to that activity reduces, and we should find that with the return to the things that we enjoy, that we have an improvement in our mood and hopefully in the long term, better management of our pain. Another key point to remember is that pain does not always mean damage. So when we are returning to activity that we haven't done for a while and it does lead to an increase in pain, of course, initially what we may feel is that we're doing further damage. However, what we need to remember is that it just takes a while for your body to get used to doing that activity again. And that's why I use the word gradually, because if we return to an activity full on, then your body's not likely to thank you for it. However, if we return gradually and gradually expose your body to that movement, then there's a higher chance that you'll be able to return to that activity with less flare-ups and less increases in pain. If you'd like to learn a little bit more about pain, then please check out a previous blog post that I've done. Again, I'll put the link in the description. And in this blog post, I talked about some key concepts around pain. So pain being our protector and pain not meaning damage, some of the things I discussed earlier. So if you'd like to know a little bit more about that in detail, then please check out that blog post. If you are struggling with pain or you know anyone who is, that blog post is a really, really good starting point to get an understanding of pain before coming to check out these videos that I'm doing. The other link that I'll put in the description is to a previous video I did on the boom-bust cycle. The boom-bust cycle represents a period of increased activity, perhaps on a good day, which is then met with an increase in pain and function and reduced activity, typically what we call a bad day. I talk about ways to manage that cycle, and that's slightly different to the cycle I'm talking about today. But often what we find is that those cycles may be present at different points in your life. So be sure to check out that video as well. So I've spoken a little bit about the pain cycle. I've given a very kind of brief overview of what it is and a kind of a simplified version that I usually use with my own patients to explain this cycle. However, there is a more detailed cycle, and I've taken this cycle from My Live Well With Pain. I'll pop the website link to that again in the description if you want to check out that website. That's a great website for patients and for clinicians, and it has lots of handy resources on there to help explain pain, help your patients manage their pain, but also if you are someone who struggles with pain, there's some really, really good tips on there as well. So looking at this cycle, what we can see is that we have the persistent pain that I've spoken about already in the previous cycle, leading to us becoming less active over time and having a loss of fitness, muscle strength, and a little bit of stiffness as well. So it's not just the physical activities that pain influences. It can also influence things like sleep, because at night, if there is pain, it can be difficult getting to sleep and staying asleep as well. We do know that if we are struggling with sleep and we're not getting a good night's sleep, it can lead to higher levels of anxiety the next day, and it can lead to more frustration and anger around the pain and also about the lack of sleep as well. Now, a lot of you watching this video may be taking some medication as well for your pain, and it's a really important thing to notice here how this is in the pain cycle as well. Often with medication, as I've spoken about before on a previous video, there are side effects, and there is no medication that comes without side effects. That can be part of this pain cycle. When we do have side effects of medication, because they can also be seen as a threat by the body, it can actually irritate our pain slightly and lead to slightly worsening levels of pain. It's not as simple as that. It goes into a little bit more detail, and I'll do a post in the future on that around how medications can actually lead to more pain. But for the moment, just looking at those side effects, it kind of is involved with the whole overall pain picture. We do know one of the side effects of some medications as well is weight gain. So there are some medications out there like your gabapentinoids, which is your pregabalin and gabapentin, and one of the big side effects of those medications is weight gain. With all the things I've previously mentioned, it can start to have an impact on the way that we're thinking and the way that we're feeling as well. Lots of negative thoughts can pop up, and that is very normal and understandable when you're dealing with pain on a daily basis. When pain is a part of your life, understandably, that can lead to lower mood and also thoughts and concerns about the future. With those thoughts, concerns about the future, that can lead to higher levels of depression or anxiety, or if you haven't suffered from anxiety and depression before, it can lead to some of those symptoms as well. Now, not just because of the physical symptoms alone, but also because of the thoughts and the emotions that are coming up with dealing with pain on a daily basis. It can lead to us needing to have time off work as well, and really starting to impact the things that we enjoy. So some of our activities, our hobbies, socialising, spending time with friends and family can all be impacted by the pain, the reduced sleep, the side effects of medication, and some of the mood changes as well that we are having. With time off work, that can obviously lead to financial concerns as well. And that plays a part in the overall picture of increasing that stress and increasing that sensitivity of the nervous system, which can also lead to more pain. If we're not able to spend as much quality time with those that we love as well, we can find that our relationships are struggling. All of the things that I've mentioned in this cycle all feed back into more pain, and the cycle continues. This can become a bit of a vicious cycle and continue for months to come, unless we're able to actually identify certain areas that we can influence and maybe change the direction of this cycle. So what I'm going to share now is the self-care cycle, which is a road to recovery and is also by the My Live Well With Pain website. Now, I do really like this cycle because it shows a lot of management strategies that we can use to manage pain. Now, what I aim to do on this YouTube channel is actually cover these strategies through these videos. I've already covered a few of those strategies, and I'll let you know which ones I have covered when we go through them now. Those that I haven't covered already, I will be looking to do that in the future. So if you haven't already done so, click subscribe so that you can be notified when I release a new video, and hopefully you will find some help in those videos in managing your pain. I'd also really appreciate it if you'd share these videos with anyone you feel may benefit from them, whether that's someone who's struggling with pain themselves, or whether that might even be a healthcare professional who works with those in pain as well. As always, if you do like the video, don't forget to click like as well. So coming around the cycle, like we did with the cycle previously, we find that the first thing there is activity planning. So what we talked about previously was that we can't always impact the pain straight away. We can't always impact that fear of worsening pain straight away. But what we can do is start to gradually reintroduce ourselves to those avoided activities or those painful activities. And that's where activity planning and goal setting comes in. What we want to be able to do is actually think about what are the activities that you're avoiding at the moment and how can we get back to them. I always say when I'm training other physiotherapists that the easiest part of our job is knowing which exercises to give out to patients, because if we listen to the patient's story well enough, they will always tell us areas in which they would like to improve or get back to. And that's the first part of basing exercises around. If you don't have a physiotherapist or you're not under a pain management service at the moment, this is something you can think about for yourself. So if you find, let's say, that you are struggling with bending and lifting because you have back pain, then something that you may want to gradually expose to is, first of all, bending. You can start off doing that in sitting, you can move to standing, and then you can add a small weight and start to re-expose to some lifting. That's a really, really good way of knowing which exercises may be helpful to improve function in the long term. We also have pacing, planning and prioritising as part of this cycle. I have done a previous video to this, so if you wanted to go and check that out, I will again leave a link to that in the description below, or you can find it on my YouTube channel. The other things that I would really like to discuss in my future videos are things around diet for chronic pain and also ways in which we can improve sleep. There's a lot of new research coming out around the impact of diet on pain, and looking particularly at inflammatory foods and anti-inflammatory food groups. So I will do a video on diet in the future. Another lifestyle area that can really influence pain is sleep. I have done a previous blog post on sleep. Again, I'll leave the link in the description to that goes through 10 ways in which you can improve your sleep, which should then help with managing your pain. But I will do a YouTube video in a few weeks' time as well that covers a little bit about sleep and ways that we can improve it. For the next two on the cycle, around skills to manage unhelpful moods and challenging negative thoughts, I am actually hoping to get some help with some videos around these topics in the future. I'm fortunate enough to work in a multidisciplinary pain management team, which has a psychology team as part of that. And hopefully what I can do is get someone involved to help me out with one of those videos. I use an element of psychological interventions with patients. However, it's not my speciality. So what I'd really like to do is get someone who is an expert in this area to talk about this and share their knowledge and experience with you guys. Finally, what I will look to do in the future is also do a video on how to manage flare-ups when we do get them. So guys, this was a quick video just to give you an overview of the pain cycle and the self-care cycle as well. As I mentioned, there are lots of videos to come that are going to cover some of the things on the self-management cycle, so I'm really looking forward to sharing that with you. As I mentioned before, please hit subscribe to my channel, give it a like and share it with those who you think may benefit from it. Thanks for tuning into this video and I will see you soon. Take care.